So thanks everyone for joining us today. For those of you that don't know me, I'm Michael Wong. I'm a veterinary neurologist at Southeast Veterinary Neurology in Miami here, and this is Dr. DiVita.
Hello.
Oh,
I'm Dr. DiVita. I'm the resident here at Southeast Veterinary Neurology. We're excited to answer your questions today.
great. So a couple things. One, thanks for joining us. Two, if you've got questions, if we're able to get to them today, put them in the comments and we'll get to them today. If we're not able to get to them today, we'll use them for a future episode. Please go ahead and share this with any of your friends that you think may find this useful. And so I believe we've got our first person here. I'll let her in right now. Hi there, how are you? Can you hear us all right?
Yes, I can.
Hi, how are you?
Hello.
Hi, good.
We've got you turned 90 degrees. I don't know if that's working for you or not. If you can flip your, perfect.
Yes.
Perfect.
So if you don't mind, just so I'm Dr. Wong. This is Dr. DiVita. We're here in Miami and happy to answer any questions you've got. What's going on? Where are you calling
Nice
from?
to meet you.
Where are you zooming in from?
We live in Minnesota,
Okay.
and my name is DiVita, and this is my fluff Misty. And Misty was diagnosed with IVDD 2 months ago. And while I'm not in shock anymore, I'm worried. And I'm trying to read and learn as much as I can about this disease. And one of the things that caught my eye on social media, that a couple of people mentioned that dogs had a flare-up, IVDD flare-up, after dental cleaning. So they say that they think it's been triggered by anesthesia. So I've been trying to find any answers, if it's true, if there is a connection, but I wasn't able to. So I'd like to hear from you what you think about it.
Sure. And I missed your dog's name. What's his or her name?
Misty.
And how old is Misty?
Misty is 6.5.
Okay. And we look like we're so how long have you had Misty?
Since she was little.
Okay. And what sort of symptoms is she showing that, how was she diagnosed with IVDD? What was she showing and what tests were done to confirm that it was IVDD?
Well, it started a couple of years ago that one day she just sat and trembled and didn't want to walk or climb the stairs, but she could do that. So we took her to vet and she was prescribed anti-inflammatory, and in 2 days she was completely fine. And then the same thing happened again, and we got the same anti-inflammatory. And then a few days after, she tried to do a little jump and screamed in pain. So I went back to vets and we got more meds, but I felt that our veterinarian wasn't very knowledgeable about this disease. So I took Misty to see a neurologist.
Okay,
we have very few here in Minnesota. And since Misty could walk fine and was seen just a few days after it all started and she was in fairly good shape, neurologists didn't feel that it was worthwhile doing MRI. And so she just told us that most likely Misty has degenerative disc disease, is judging by her breed. She's Coton de Toulier. She has long body and short legs. And because she had this previous episode, and so that's all we know for now. And she was on crate rest and took medication, and she recovered nicely. So we don't know if it's 100% that, but that's.
Yeah, so it certainly sounds like symptoms of IVDD. Symptoms of IVDD can range from just being painful, and it can be intermittent, all the way to inability to walk or inability to move or even feel the legs. So it sounds like she was relatively mildly affected, and trying rest and medications was a very, very reasonable thing to do, and it seems to be helping her. So I just wanted to get that bit of information to make sure that we were on the right track with regards to answering your question. So we probably have intervertebral disc disease. That would be my number one concern based off of your description and response to medications and just for how long it's been going on. But we have to ask those sorts of questions just to make sure that there isn't something else that can cause those exact same symptoms, like meningitis. We see that in 6-year-old small breed, long back, short-legged dogs that can look the exact same. So to answer your question about flare-ups, yes, flare-ups happen. So a dog that has one episode of intervertebral disc disease has about a 50% chance of having another problem at some point in their life. So what some people will call a flare-up or a recurrence. And that flare-up can be the exact same symptoms. It can be more mild, where it's just pain. It can be more severe, where it's wobbly walking. The symptoms can actually come back in a different part of the body. So we might slip a disc in our back one year and have a flare-up, or slip a disc in the neck in another year. So with regards to anesthesia actually causing that, I would be doubtful that the anesthesia itself causes it, just because a dog that already has one slip disc is predisposed to more slip discs. So if symptoms come back, it's a question of, have we slipped a new disc, or have we aggravated or had a flare-up at the same disc site as before? It's not so much, in my opinion, that the anesthesia or the medications itself have caused the flare-up. It's more likely when we give anesthesia, just the dog's muscles relax, and things that may have kept her neck or her back in line, we've taken away that sort of protective mechanism by sedating her or anesthetizing her. Also, sometimes when we're doing a dental cleaning, even though we're being very careful to position her and move her around, just when dogs are asleep and they're not holding themselves more rigid, sure, could the positioning or moving them around cause a disc to become aggravated, whether more disc material comes out, or does it just irritate that nerve or the coverings of the spinal cord more? So that would be my thought process on anesthesia. So I don't think the anesthesia itself causes it, but sometimes just the positioning. We get the question a lot of, well, can I anesthetize my dog for a dental cleaning, after a slip disc surgery? In general, or not even just after surgery, but when we're under treatment, in general, we try and postpone that anesthetic procedure until kind of the dog's gone through the complete rest period, and we say, well, gosh, this flare-up or this event has settled down. Now we're comfortable anesthetizing, but your veterinarian needs to know, hey, my dog's had a disc problem in the past, just be extra gentle. Not that that makes it impossible, no matter how gentle they are, dog can still have a flare-up, but it doesn't hurt for them to know about that. Dr. DiVita, do you have any thoughts on?
No, I think I agree with everything that you said. One of the stories I like to tell some of my owners is that last year during my internship, I saw a patient who sneezed and slipped a disc after sneezing. So sometimes the correlation to a specific event, or what owners would refer to as a traumatic event, sometimes we can't make that correlation. They're everyday activities, sneezing, going to sleep in the crate, just walking or turning the wrong way, that can cause a dog to have a flare-up. So I think, like Dr. Wong said, just letting your veterinarian know Misty's history. And I always offer as well for, the veterinarian performing the dental to give myself or our office a call. So that's something you could chat with your neurologist about, is would they be willing to chat with the veterinarian performing the procedure, just to talk about all the things we just chatted about.
Great advice. Thank you.
You're very welcome.
You have any other questions?
That's it, I believe, for this time. Thank you very much for taking my question. That's been on my mind, and I was curious, and as I say, couldn't find information anywhere. So I'm glad you took my question.
It's a common question, but I don't think there's a lot out there written on the internet of, you know, can a dental cleaning exacerbate my dog's IVDD signs? Maybe we'll get working on that.
Right. You have huge social media presence. Like, I know you guys better than I know Mrs. Neurologist because, because of COVID, I couldn't walk into clinic. So yeah, it's great what you do.
I appreciate that.
Thank you.
All right. Well, if you need anything, feel free to reach out. You know how to get a hold of us, and you can message us or message Emily at any time. And if you have questions in the future, that Q&A, so ANDA at SEVneurology.com. Feel free to submit stuff there or give us a call.
Okay. Thank you so much. Have a good day.
Take care.
Bye-bye.
Bye.
That was nice.
Yeah. Misty's cute. I like her.
Very cute. Yeah, that's one of the things that I like, is I don't know if you're preparing, Emily, them to bring their dog along, but I kind of like it when they surprise us and their dog's there and sitting there. It's almost like, like Mom just said there, with coronavirus, she's not able to go to her veterinarian as easily as she normally would. We're not actually, that's one of the things that I miss most about, COVID-19 or practicing veterinary medicine with COVID-19 is I'm just not meeting those clients face to face as much. So this is actually really fun for me to meet with.
It sounds silly, but when I'm walking on the street and see like an owner with a dog that looks potentially familiar, I'm like, I wonder if that's them. But I've never actually asked.
Yep. Soon people will be recognizing you and asking you. So we've got a little bit before Kelsey's question. Did you want to? I can read you Cecily Ann's question. You can take a stab at it. So from Facebook, we've got a question here. I just got back from our vet appointment for Coda's first neurologic check and to get his staples out. So it sounds like Coda just had surgery. The neurologist said that he showed essentially no improvement from when they saw him last a week prior. So we should assume at this point that he won't regain of his rear legs. She didn't give him a 0% chance, but definitely nowhere near the 50-50 odds when he first went in. He is not even 2 weeks since the surgery and has been doing great aside from the paralysis. Plus, he isn't even 3 years old. Again, he was stage 5 and lost deep pain perception about 6 to 8 hours before the surgery. So what that means is he was unable to move and feel his limbs. So on a scale of 1 to 5, with 5 being the most severe, it sounds like Coda was the most severe category. Those are dogs that we want to be operating on lickety split. So those are the dogs, when we see them here, we kind of drop everything that we're doing and get to that dog first. Those are the dogs when someone calls us at 8 o'clock at night, and we've gone home, we come back in for those. So Cecily's question, has anyone experienced a surprising paralysis recovery later in the game? I feel like 2 weeks isn't really enough time for her to seem so sure. I know there are cases of dogs recovering months after, but I guess I'm just stuck between holding out hope and coming to terms with his paralysis. I know I can try to do both, but it's hard to not get your hopes up or fully commit to getting him the wheels, etc. Either way, we're going to spoil the crap out of him and give him the best life possible, just struggling with the mental aspect of all of this. A lot of good perspective there, Cecily. Dr. DiVita, you want to take a crack at it and try and help her out?
First and foremost, it sounds like Coda's really lucky to have Cecily as a mom. So kudos to, kind of taking on the challenge of taking care of a paralyzed dog, obviously doing everything you could for Coda. So we obviously appreciate owners who, have that commitment to their pets. So again, kudos to you. As far as it goes in terms of dogs who are a grade 5, we typically like to give them 4 weeks from the time of surgery before we say that the likelihood is that they won't recover. Sure, there are definitely dogs that can get feeling back after the 4 weeks, but the chances of that happening are exponentially low. I don't know if there's a percentage or a published value, but I would assume they're quite low. So I would still give Coda a little bit of time, seeing him or seeing your neurologist again in 4 weeks. And what I like to tell owners in these cases is that at the 4-week mark, I'm not looking for big changes. I'm looking for, does he have a little bit of sensation? Can he feel a toe or 2 toes as opposed to feeling 0 toes? If we have some improvement, even if it's 2 to 5% improvement, I like to say, let's keep a little bit of hope. We need to keep a realistic amount of hope, and realize that he may not recover. However, we can still keep trying and doing things like rehabilitation if we make some improvement in that 4-week time span. Obviously, rehab's never going to hurt 4 weeks, 6 weeks, 4 months after surgery. But I typically like to prepare owners to start looking into the wheelchair option, and from a mental perspective, getting ready to have a paralyzed dog at that 4-week time point. So I think it's realistic to still hold out a little bit of hope at this point, but also keeping in the back of your mind, if we don't recover, it sounds like Coda's the best prepared dog to have a good quality of life going forward as a paralyzed dog. And we get a wheelchair, he adapts, and I call them differently abled dogs as opposed to disabled dogs, because most dogs in a wheelchair enjoy life to the fullest, and you'd never know anything was wrong with them unless you saw them in their wheelchair. So I think that's kind of what I like to prepare my owners for. I don't know if you think something different.
Yeah, I'm pretty much in line with that. I think Mom hit the nail on the head here, where she said, I guess I'm just stuck between holding out hope and coming to terms with his paralysis. And I think that's exactly what you need to do. I mean, we never want to be the person or the people that take away your hope, but at the same time, we want to give you a realistic look of what life is going to be like. So, most often I'm having this conversation when I'm meeting the client. So when I meet the dog and it's paraplegic with absent deep pain perception, I'm setting them up at that time that there's about a 50% chance of regaining feeling and a 50% chance that we don't regain feeling and we're permanently paralyzed. And yeah, just setting them up for that, being patient. I give it a month. Most neurologists that I know do give it 2 weeks. I've just had a handful of dogs that I rechecked at 2 weeks and they couldn't feel their legs, and I rechecked them at 4 weeks and they could. It's the vast minority. I do think the vast majority that regain feeling, regain it in those first 2 weeks. But yeah, I always want to see that dog back at 4 weeks just to check in. I've actually never had a dog regain feeling after 4 weeks, but anything's possible in this world. So I'm setting up clients at that time of, just like you said, we're going to recheck, we're going to take out your dog's sutures in 7 to 10 days. We're going to be checking in frequently because most of these dogs need bladder expressions. We're going to want to see back in about a month to do that final pinch. And the reality of what happens over that month is most owners realize, hey, this isn't so bad. My dog is out of pain. My dog's super duper happy. My dog's completely the same dog from the waist up as he or she was, before this started. And hey, I'm getting the hand of bladder expression and, physical therapy, et cetera. So most of the time at that 1 month recheck, if they've regained feeling or even that 2%, 5% something, yeah, we've got something. Double down on everything you're doing, don't give up hope, keep doing everything you're doing. Ones that can't feel, I'm saying, hey, don't give up hope, but we need to be prepared that feeling isn't going to come back and your dog's never going to voluntarily walk on his own, on her own. But at that point, 99% of owners are like, hey, I can handle this. When I go out and take my dog on a walk on a wheelchair, just, the neighbors come out and are asking questions and et cetera, et cetera. So. So yeah, I don't know if you know, or anyone that's watching this, I had a paralyzed dog for 12 years or so. She was hit by a car before we got her and was not a surgical candidate, and she was paralyzed, and she had a great quality of life. You know, the first week or so that she was in the wheelchair, she didn't like it. She just kind of put on the brakes, but by the end of that week, she was doing 3-point turns, you know, chasing the other dogs. So they don't feel sorry for themselves, and, you know, nothing slows them down.
I think the last point I'll make, if we have time, is that, you know, I always strongly recommend that they get a custom fitted cart as well, because a lot of people will, you know, look online and see the ones that are a little bit more cost effective. However, some of the custom fitted carts, I think, are just more beneficial for the dog. The companies make sure that they're not going to rub in the wrong places, that the feet won't drag on the ground, things like that, by doing the measurements appropriately. So that's something we like to recommend as well, is, you know, making sure that cart is perfect for your dog, because they will be in it for their walks and for their activity. So we want to make sure they're as comfortable as possible in that cart.
Yeah, if there are any other questions. I know a lot of the rehab services down here, they'll actually, one, they'll do cart fittings, but two, they'll even let you try out. You know, they've got 4 different brands at their hospital, and they'll let you try out different ones to just see, 1, how your dog adapts to it, and 2, which one works out best for you. So that's something worth asking. Golly gee, still got a little bit before our next person is going to be here.
A couple questions here.
Sure, we've got some questions in the comments. So we've got a question here, Dr. Oh, where did it go? How do you supplement for exercise in a dog that has idiopathic epilepsy when it's so hot to go on walks in Miami? I think you can answer that question even without taking out the statement of epilepsy. How do you walk a dog in Miami in the heat? So
4 in the morning and midnight is my schedule. So I think, you know, being cognizant of the temperature and the time of day. Obviously, midday is not a good time to walk your dog. I think short, slow, controlled walks, so multiple walks a day, as opposed to doing a, you know, hour walk or a mile walk or whatever your normal routine is, breaking that up into a shorter time span would be more beneficial to get, you know, so that we're not outside for hours at a time when it's really hot out, but so that we still get the amount of exercise. And then I always tell people to invest in some type of exercise or activity that we can do in the house to keep dogs stimulated. So my favorite thing is the interactive feeders, the puzzle toys, or the balls that you roll around, that they roll around the house, if you can tolerate them rolling a ball around your house to eat their meal. That's how my dog eats most days, and it keeps him active. It takes him longer to eat his food, and it gives him something to do when I'm not home, that I can put his little ball toy out and he can roll it around and eat his little kibbles and treats. So it keeps him moving around, as opposed to being a couch potato when I'm not there with him. So those are some of my recommendations for keeping dogs active in the heat. Swimming's also great exercise if you have access to a pool or a body of water, but also being cognizant, again, if you have a big fluffy dog, they're not going to dry. We don't want to keep them out in the sun after that.
yeah, I mean, I think some of it also depends on the breed, the Frenchies, the Huskies, things like that. So as it pertains exactly to idiopathic epilepsy, there isn't always or even typically a correlation between exercise or heat causing a seizure. So if that's the question, I guess I wouldn't treat it any differently than any other dog in heat stroke in Miami. If exercise is something that seems to set off seizures in your dog, yeah, even more so, just avoiding the heat.
Yeah.
All of the things Dr. DiVita said.
Yeah.
Great. Well, it looks like Kelsey's here. I lost my, let's bring her on in. Hey, Kelsey, I think you're still muted. So in the lower left, there you go.
Okay,
Perfect.
awesome. Hello. How are you guys?
All right. There's a little bit of a delay, so bear with us. And I can't hear you super well. Dr. DiVita, are you having a...
Yeah, I can hear just a little bit low, but I'll be fine.
Hi, Kelsey. I'm Dr. Wong. This is Dr. DiVita. What's going on with your pet? What's your pet's name, age and breed, and where are you located?
I'm in Northern California, and my dog is Fat Boy. 6 months, and he's an American bully. On like April 27th, his back legs stopped working correctly. When he would go to, let's say like run or he's excited, they start like twisting and not working correctly. Like his weight isn't fully on them as well. He recently just stopped wanting to go up the stairs as well. It's too hard for him to do stairs. We got an x-ray and nothing popped up, so they recommended getting an MRI. But my question is like, I don't know if it's IVDD, but after watching a bunch of videos, I almost assumed that, but obviously I can't self-diagnose. But I was wondering if you could see IVDD on a CT scan.
Sure. If it's all right if I just ask a couple more questions about Fat Boy. So you said he's 9 months old now?
He's 6 months old.
6 months, sorry. And when you emailed us, you said 4 months. So has this been going on for 2 months, or how long has this been going on?
It started on April 26th or 7th.
And does he seem painful? Like, does he whimper or cry, or when you pick him up or move him, does he?
Before we took him to the vet and she put him on anti-inflammatory medication, he would scream super loud when we picked him up.
Okay.
And so that's why we took him there in the first place. Everyone was saying, oh, he needs his anal glands cleaned, because apparently those types of dogs need their anal glands cleaned. I don't know. But so we took him, and she had thought maybe it was something with his tailbone, and she's like, just wait it out a little bit, see if he grows out of it. And then like probably a month later, that's when we noticed his legs weren't working correctly.
And when you say his legs aren't working correctly, is it only during exercise, or are his legs kind of always a little funny now?
They're always a little funny, but they're the worst on slippery floors, like
Okay.
Hardwood floor.
And so they're slipping out. Are they kind of crisscrossing or buckling over onto the top of the foot?
They do both, actually. When he's more excited, that's when they like crisscross, but when he goes to get up, they kind of like go over his toes, and then he can sort of get up normal, and he'll walk for a while normal, and then they'll just start crisscrossing again and being super weird.
And the medications, the anti-inflammatories, did that seem to help? One, the screaming, and two, the amount of slipping and crisscrossing?
It didn't help the amount of slipping, but it did help his pain. He doesn't cry anymore when we pick him up, or he doesn't show any pain. He just wants to play all day. The vet recommended we keep him crated, though, besides to go to the bathroom and to eat.
Okay. Dr. DiVita, you want to have any other questions?
I don't think I have any other questions. I think that's probably good. I can start. Yeah. Okay, cool. So it sounds like Fat Boy, from your description, likely has a neurologic problem affecting his spinal cord and his back. It's a little bit tough to know, obviously, without doing a full exam and meeting him and meeting you, because there are some orthopedic diseases that can mimic neurologic disease, but from your description, with the knuckling and the crossing, those are all kind of telltale signs of a spinal cord problem. Okay. In such a young dog and in a large breed dog, I actually wouldn't expect IVDD to be one of the top considerations. Certainly possible. I guess I've never seen a disc herniation in a dog younger than about a year old. And American bulldogs and bully breeds can get slip discs, but we typically think of them either being older, and obviously our dachshunds and French bulldogs and Shih Tzus are our more classic, breeds for IVDD. In such a young puppy, they can have a few different things that would be a little bit higher on our list. So they can definitely be, unfortunately, born with some congenital abnormalities or malformations that can make them, walk funny from a young age. They can have infections, whether infections in the discs and the bones or in, the nervous system, the spinal cord itself. They can also get types of inflammation, so autoimmune diseases, although again, relatively young for those kinds of problems. So CT scans are really good at looking at the bones. So CT scans would tell us, how have the bones formed? Are they aligned appropriately? Do we see any things like fractures or luxations or, even infections? But CT scans won't tell us about the actual spinal cord itself or the nerves that exit the spinal cord. So that's where MRI is a little bit better. MRI shows us the spinal cord and the nerves and the discs and all of that. It shows us the bones. CT is better at showing us bones, but MRI is kind of the full picture more so. So, in our patient, we would definitely recommend an MRI scan over a CT for Fat Boy. And at least in our hospital, we require anesthesia for both. So the risk is relatively similar. Cost is relatively similar, at least here in Miami as well. I'm not sure about in California. Sometimes we pair that testing with things like testing for infectious diseases, or things like spinal taps to look at the spinal fluid. So a lot of it would be dependent on, what we saw on the pictures and on the images. Have you done any, and you might have said this, have you done x-rays yet?
Yeah, we did do x-rays, but nothing popped up, and so that's where our vet recommended us to get an MRI. But where I live, they're 6 hours away, and we have a CT scan thing here, so I just was curious about that.
Is there a neurologist closer, or is the neurologist the same distance to the MRI, I presume?
It's the same distance. It's about 5 hours away. And then also the CT scan was like $700, whereas the MRI was like $4,000, so it was also like a big price difference. But after hearing that it's more of the bones and not really neurology, with his head and stuff, I can't even say the word, oh my goodness. But after hearing what you just explained to me, that makes a lot more sense of a CT scan and an MRI. I tried Googling it, but I just wasn't getting it.
Yeah.
I guess to answer your initial question, can we see intervertebral disc disease on a CAT scan? Certain times we can see it on a CAT scan. So sometimes certain dogs like dachshunds and other what we call chondrodystrophic breeds, so kind of the short leg, long back, sometimes their discs are calcified, and that shows up looking the same amount of brightness as bone. So it's very, very easy to see on a CAT scan. So there are times where it's appropriate to do a CAT scan. Being that we have CT and MRI here, just 99.9% of the time we're doing an MRI here. From there, it becomes sort of I don't say an experience thing, but knowing what you're looking for. And that's where I do think meeting with a neurologist that could examine Fat Boy, and they would be able to say, based on my evaluation in person, I agree it's a mid-back spinal cord problem, it's a neurological problem, and that my list of possible causes is similar to what Dr. DiVita had said, and that an MRI is the next step. So sometimes they might look and say, well, gosh, it's a brain problem. I mean, I get messages like that all the time where it's this exact question, should I get a CT or an MRI? And, our cart's before our horse. I look at the video of the dog on Facebook and I'm like, that dog has a brain problem. You shouldn't be doing a CAT scan of its back. So there's definitely going to be value, even if you can't do the MRI or you're not sure. I think of just getting someone that looks at neurological problems day in and day out to look at Fat Boy, to one, say, yes, it's neurological, two, that it's affecting the back, because if it's something, for example, affecting the brain, we're 100% not going to recommend a CAT scan because we're not looking for things like intervertebral disc disease anymore. So from there, it becomes a bit of a judgment call, you know, and weighing the pros and cons. You know, if I don't want to get on here and beat up CT too much because it's a fantastic tool, and you know, there are people where a neurologist isn't 6 hours, it's 12 hours away, and an MRI isn't 6 hours away, it's, you know, a country away or stuff like that. So there's still value of CT, but if you've got the option, in general, MRI is going to be, based on what you're describing, our recommendation. But I think you would be absolutely best served, and Fat Boy would be best served by getting that neuro consult, just so that you can make that best decision for him.
Okay. Another thing that I had a question about was when she gave us the anti-inflammatory medication, he was on it for about 32 days. And then after we took him off, because she said she didn't want him on it for too long. But after, he seems just fine. Like, he's not in pain anymore or like that screaming, yelling. But he's not on the medication. So I'm just kind of curious why that would be, if you would be able to tell me.
Yeah, I mean, to me, that can be a couple things. It comes down to what the underlying cause is.
Right.
So if it's something that the injury was there, and so let's pretend it's a slipped disc, even though for the reasons we said, it's not common in a 4-year-old, you know, or excuse me, 4-month-old large breed dog. But let's say it's something like a slipped disc. Sometimes that can get better on its own, and we just need anti-inflammatories to get us over that hump, and they start feeling better and they're healing. What was the anti-inflammatory? I can't remember if you told us.
I honestly have no idea. I don't remember. I just know that's what she called it, was an anti-inflammatory.
Was it kind of on a high dose, middle dose, low dose, or was it just kind of a?
I don't remember. She had me give it to him 2 times a day though, morning and night.
So there are multiple reasons that, I mean, the medications could have gotten us over that hump, and whatever the condition is was only painful in the beginning, and getting us over that hump is all we needed to do. There's also the potential that it's just been masking it, and you know, symptoms may come back. So my hope is that this is something that was temporary, and anti-inflammatories and rest was all that he needed.
We try and keep him in a kennel like she suggests, but sometimes we do take him to like the park just to play, because I feel like that's just like, I would be sad sitting in a kennel all day, you know? But like if he's in the kennel for about 3 or 4 days, like fully, and then we take him out, he'll do really well, and then the next day is when he starts acting weird again with his legs.
Yeah.
So it's kind of like the more movement he gets, the worse it gets.
Me?
Sure.
Yeah, so we realize that creating a dog is hard, and especially a 6-month-old bully puppy. I don't have one, but I can imagine. But it does sound like it's probably the best thing for him. So if you feel like you have to take him out, which obviously is super reasonable, I would just make sure he's doing more controlled activity. You know, it does lend itself more as well to, you know, a neurologic problem. When we have orthopedic problems, they're typically kind of variable throughout the day, and oftentimes worse after periods of rest. So again, that's just one more tick in the box, you know, towards the neurologic or spinal problem. And again, just from a not being able to evaluate Fat Boy in person standpoint. So controlled activity, meaning, you know, he's on a leash and a chest harness, you're going for a short walk around the block a few times a day. or we let him out of the crate again on his leash and harness in the house to have, you know, dinner or to sit while we're watching TV just so that he can be with us, because obviously puppies at 6 months still need that socialization period. They still need that exercise. Kong toys for his crate as well are probably super useful. But again, I think it just speaks to what Dr. Wong said is, you know, visiting with a neurologist may give you options other than an MRI, and potentially options that may make him feel better and that may allow us to eventually get off of that crate rest and still provide him a really great quality of life.
Right.
So we realize that it's easy for us to say that because we don't drive 6 hours, but you know, maybe make a little trip out of it for a day or something like that.
They're during the coronavirus, they're not taking appointments until September, so they're still only doing emergencies. So we can't get an appointment right now. That's why I've been doing like so much research and just stressing on it so bad, like a little kid, you know. But I know it's not an emergency appointment, so I know they can't get us in. But I'm so glad that you guys were able to help me kind of understand that it's probably not IVDD.
Yeah, feel free to, I mean, if you can get a video of the way he's walking, you can email that to us. I'll have Emily get with you, and you know, maybe we can be a little bit more help there, and you know, just be able to take a look, and that may change what we say. It, you know, may not, but it'll certainly give us a little bit more insight of what's going on with Fat Boy.
Our original vet, she didn't even really suggest a CT scan. We went to go see if hydrotherapy would maybe be like good for him to exercise a little bit and work his legs, and they were the ones that suggested the CT scan. And when I had called her, she's like, oh, well, I don't really know much about CT scans. I know it's just like a little more than an x-ray, but not much. So she also was saying it probably wouldn't work for him. So I think it's just good to have that second opinion, you know, just
Yeah, definitely. I mean, and we sort of glossed right over that. I mean, a CT uses the same technology as an X-ray, but instead of, when we do an X-ray, we kind of take a you know, side-to-side shot and a front-to-back shot, and that gives us two different pictures that we can sort of triangulate in our mind where a problem is, or where an object is. But things sort of it's like casting a shadow. So they sort of silhouette, they overlap on each other. Whereas when we do a CAT scan, what it does is it kind of takes pictures, or it does x-rays 360 degrees around it, and then the computer can sort of remap that out into slices. So it's a big step up from an x-ray, because it takes away all of that superimposition, and we can see sort of internal structures more than on an x-ray. But it's what we call tissue resolution. So air is dark on an x-ray, metal's very, very white, and you know, bones are white, but kind of all of your internal organs, your heart, your spinal cord, your intestines, your kidneys, etc., are all just kind of shades of gray. So it's really hard to tell the difference between one and the other on a plain x-ray, or even on a CAT scan. We can get a sense of where they are, of what they are, excuse me, based off of their location, but their internal structure, we don't get quite as much what we call tissue resolution, where on an MRI, fluid can look one very distinct way, and there's a lot more contrast between different types of tissues. And then what we do is different sequences that sort of accentuate those different substances. So we can, with much more clarity, say, you know, this is fluid, this is blood, this is bruising, this is edema, etc. All right, well, send us that video of Fat Boy moving around, and we'll take a look at it. And please, if you have any more questions, feel free to reach out to us.
Okay, thank you guys for reaching out to me. I'm so happy you did.
You got it. Thank
I
you.
had a night where I watched every single one of your guys' videos. I was just like, could it be this? Could it be this?
I appreciate you watching. If you could do one thing, is just share it with a friend or anyone that you think might get a use out of it. So
Yeah,
we'd
totally.
really appreciate that.
I have a hard time like telling people what a vet tells me because there's so many big words. So this is awesome that I can just share it with people and be like, see, this is what he said.
Definitely.
Thank you again.
You got it. Nice meeting you.
Nice
Have a
meeting
good day.
you.
All right. So we've got Christina next. Again, just anyone that's here, if you can share this or drop questions in the comment section, we'll keep rolling.
Cool.
Hello.
Hello.
Hi,
Hiya.
Christina. I'm
Yes,
Dr.
hi
Wong.
there.
Michael, this is Dr.
Hi.
DiVita.
I'm sorry, just you can hear my dog there in the background.
No, that's great. So where are you? Where are you located? What's your dog's name, and what's going on with your puppy?
Okay, so I'm calling from Scotland, Glasgow in Scotland. I've got a French bulldog. She's a female. She's 3.5 years old.
And what's going on with her?
And yeah, she's got IVDD. So basically what happened in December, she had surgery for an extruded disc. And that was like, after she developed some back pain, and it progressed really quickly to like paralysis in the back legs. But she still had deep pain sensations. So done the surgery, and she's made a full recovery since then. But what's happened about a week ago, she started showing again the symptoms of the back pain and the weakness in the legs. So because we already knew what to look for, we took her straight away to the neurology. And they kept her over for 2 days, just on medication and just crate rest. And they said, because she's not lost any neurological function, she's still able to walk, although she had, weakness and pain. But because she's, responded quite well to the medication, they said no need to do MRI and surgery as yet because she's showing improvement. So they said, just the crate rest for 4 weeks. And the area should sort of heal over, where the disc is kind of obviously protruding into the spinal cord. So it should kind of scar over, and the spinal cord should adapt to the space that is there. But really my question was that, because obviously when they did the surgery, they fixed the disc and also the adjacent ones, they made the fenestration. So I thought, well, that's fixed, don't have to worry about those 3 anymore. But this one has come out a wee bit, and yeah, okay, it can heal over, but is it not some area that is lost integrity over time? And when she goes back to normal, is it not a danger is going to come out, but more, and she needs the surgery on it anyway? So basically, is the crate rest as effective as the surgery, or is it, I'm just worried about how to go in the future for that kind of thing.
Dr. DiVita?
Yeah. First and foremost, is Kira your puppy? Is that the notes that I have here?
Kyra.
Okay. So again, super lucky to have a great mom who is FaceTiming us all the way from Scotland. That's pretty awesome.
Thank you.
You're welcome. So first of all, how's she doing now? Is she still in the crate at home with you?
Yeah. I mean, it was happening on Friday, so she was 2 days in the hospital because they just wanted to keep her there, on like morphine, and to see if she degrades, then they could do the surgery straight away. If she, shows kind of like worsens or anything. So instead of us having to take her back there, if something happens. So they took her there, gave her like intravenous like morphine and tanks, and she improved. The pain went away. She's walk without pain. So they said to us for the 4 weeks to be in the crate, just for the toilet walks, So she's in the crate at the moment, and she's still doing okay, She doesn't like it very much to be in there, She keeps like whining and want to be out, but it's okay. She's doing well. She's walking okay. She's doing the toilet. She's eating. So she's well, but I'm just worried when she's back to her normal activity, is this site where the disc obviously came out a wee bit, is it gonna go
Yeah.
You know.
It's a little bit tough to know. So certainly, you know, the medical approach is approach that we would agree with giving a dog that is in Kyra's position. So meaning a dog that can still walk. It's really reasonable to try a medical conservative approach first, especially given that she's been through surgery just a few months ago. And you've described that, yes, the hole in the disc where it ruptured out is allowed to heal over during that 4 weeks. We give the disc material that's in the spinal canal time to kind of scar over, become a little bit smoother and less irritating to the spinal cord, and also give the cord some time to acclimate to having a bit less room. So just like you said, that material will always be in the spinal canal. It will not, you know, it will not go away in probably 99% of cases. So I think you're correct. There's always a chance when we've got a weak disc or weak discs that, yes, in the future, it could be a problem. But if we do the appropriate rest, we kind of decrease the risk of that one becoming an issue. What I like to think about as well is in a young French Bulldog that's already had a disc problem in the past, you know, do we want to put her through surgery if she doesn't quite need it? Or do we want to save that surgery for a time where she might need it a little bit more? And I always tell my owners, I give it 2 weeks. So if she's not improved in 2 weeks, you know, then we know what we have to do. So if she's the same or worse in 2 weeks, and obviously worse at any point, surgery is the way that I would go with my patient. But if she improves at that, you know, kind of 2 week mark, we can continue the conservative approach and try to avoid having to put her through another surgery. But you are correct. There's always a chance that more of that disc ruptures out. It will always be a weaker disc. In a Bulldog that's that young with a history of disc problems, the likelihood is that she has other weaker discs, unfortunately, just because of her breed. So one of the things I recommend to my owners is some lifestyle modifications when she is out of the crate and able to do the things that she wants to do.
Like no jumping and no stairs and things like that.
So retraining her.
We already have.
Good.
Yeah, we already, you know, after the first one, obviously we, I've done a lot of research on this, and then I know the jumping and the stairs, so we like kind of got all the sorts of things like the ramps and the wee things, so she doesn't do the jumping. Sorry, I'm just trying to find something on my phone here. But, you know, 85% of the time, but, you know, sometimes she hears something or get excited, you know, and you cannot be 100% foolproof, so she does just jump over the whole thing, and you're just like, you know, oh my God, and you think, is this the time when this happened, you know? But we try to limit it as much as possible. As I say, it's never going to be, you know, I feel it's never going to be 100%.
I mean, you know, a dog is going to be a dog, and you've hit the nail on the head. They're going to do the silly things that we don't want them to do. The other thing that I'll mention, obviously I can't see her, but keeping her a little bit leaner can be super beneficial.
She's
perfect.
Yeah, she's quite fat, and she doesn't have any overweight. No, we definitely, that's what I thought. Like, see, before I knew about the IVDD, I always thought, well, because I knew the problem with the spine, I didn't know much about it at that point, but I thought, well, if I keep her fat, it probably prevents it. But obviously I didn't know at that point it was genetic, and it doesn't really matter what I do. But I was like, you know, always fat and walking, and she's actually pretty fat. So yeah, but obviously it didn't matter in that.
You know, getting a little bit of weight off of her will just take a little bit of that extra stress off the spine and the joints as well. Same for you and I, you know, keeping a leaner body condition is just healthier in general, and especially for exposed breeds, that might be beneficial for her. So substituting in some healthy snacks, carrots, green beans, broccoli, things like that.
I know, that's absolutely. No, she's a good weight. She's actually been, you know, stable weight, and you know, she's never been overweight. So, and the vet always says she's fat. She's had a good muscle. So that, and even when she had the surgery, you know, she's never lost any muscle. Oh, not much anyway. So we thought it's okay at least to try and do that. But yeah, pretty much that was just, I wanted to know about that, because I know it probably can come out again. I know is any more discs that can go, even though not this one. Is there anything else? That they say about the veterinary disc supplement. Is there any science behind it, or is it just a money scamming thing? Because lots of people use it, but when I spoke to my neurologist, they were like, I don't know, this thing, it's not replacing the material anyway. So,
Dr. Wong, I'll let you take the question about Vetridisc.
Just laughing at you.
To my knowledge, there's no evidence that there's no studies that show dogs that we give it to are less likely to have a problem in the future. In my mind, a dog that's had one disc problem in its life without surgery has about a 50% chance of having another problem. And with surgery and fenestration, as Kyra got, it drops down to about a 10 to 15% chance. But like you said, they just kind of did the 3 or 4 disc spaces nearby. We can't open up the entire back.
So I was, fix the whole lot.
So there's still a 10 to 15% chance, of having another problem, just as she did. The fact that she's so young, the fact that she's a French bulldog, she's got plenty of years to have, unfortunately, a third disc problem. I agree.
I know, because
the fact that we've had a second problem this quick, the fact that she's this young, the fact that she's a French bulldog, and the fact that it didn't happen, it's not as severe this time. Yeah, I would be inclined to manage it medically. It sounds like she's improving. The likelihood of getting better with rest and medications when we're only painful, is like 65, 70% chance of getting better. So it's very much very reasonable. Whereas last time, she was progressing, she had gone from painful to not walking to paralysis. MRI and surgery was the right thing at that point. So it sounds like you're on the right track. Keep doing what you're doing. The things that we encourage are exactly what Dr. DiVita said. Avoid the high impact activity, like you had said. But the reality is, she needs to be a dog, so we can't keep her in a crate forever. It's kind of tough.
No, I wouldn't want her to live like that. So.
Exactly. It's tough love for like 12 weeks. It's 4 weeks of crate rest, 4 weeks of room rest, 4 weeks of house rest is kind of the recipe that I follow, gradually increasing how much activity she has, but still trying to avoid those high impact activities, and then just trying to prevent where we can. Losing some weight is certainly going to decrease the stress on her back. I don't really have any evidence to say, gosh, losing.
Oh, no, she doesn't need to. I can show you a picture of her. I don't know if let me see if I can find one just to share it on the screen, right? We tried to take her swimming and things like that, because we thought that would help her back, but she hated it.
Yeah, I don't see many Frenchies that swim. I see them that like jump in the pool, and they love to splash sort of in the shallow end, but
No, well, she can swim, but she just doesn't like it. She like tried to escape. So you see, that's her, and you can see. Oh, sorry, I cannot share the screen. It's disabled. I was gonna just share it.
Let's see if I can give you. Yeah, I'm honestly not sure how to do that. The only way I know how to do that is to make you host, but that'd probably mess up with our live.
Oh no, that's a shame, because I actually wanted to show you one of the MRIs as well, just to ask your opinion on it.
I would love to look at them. If you want to email them to us, we're happy to do that, or happy to do that. Email them to Emily, and we'll take a peek at them, and we'll look at a picture of her.
No, it was just because like when after they've done the MRIs, they said there's quite a lot of the disc degeneration. So if you compare it to like the healthy dog, which is like white areas, and then hers are like really dark, it's almost not there, like just dark, obviously, so quite calcified. And I was just wondering, is that a precursor to, obviously, Oh, sure. Is that a precursor to it happening again, or is that just normal? I don't know.
So the discs normally on a MRI, on a T2 weighted MRI, the inside part of the disc should be bright. I think Kyra is asking if she can get on the video as opposed to just send a picture.
Oh, like to put it on my phone.
I'm saying because Kyra's barking in the background. It sounds like she wants to get a video.
Oh no, it's because she's not a. I can put it on this thing, right? See if you can see it, right?
Yeah. So on an MRI, normally the discs look bright on a T2 weighted image. But when the discs lose that jelly-like consistency, they can look dark, just like what you're showing there. And yeah, on that it looked like
That's
all of the
they are all like because they showed us a comparison to like a healthy dog, and they were all like bright white, and basically there is not much there at all, but it's like you know, soft tissue is all like hard, isn't it? Because that's all dark. So I just wonder, is that something that you think, oh well, they're all gonna go at some point, or
it's a marker for disc disease, but that does not necessarily mean that one's going to go. So let's pretend that all of her discs were bright except for two, that, you know, the one that had already gone and then another one. It does not necessarily mean that that other one is going to be a problem in the future. It's a marker for disc disease, but we kind of already know that just because she's a French Bulldog and just because she's had disc disease in the past. So can we use that to predict, will she have another problem? No. Or when that problem will happen, or which disc it will be? No, we can't use that information.
I know, it's just because they said, you know, when after the MRI rating, they said, well, because it's quite severe, you know, you can see obviously various degrees of disc degeneration, and some is not so bad as the others. And obviously hers was quite bad, so that's all I was asking. Like, you know, is it a reason to think, oh dear, this is really bad, and you know, that sort of thing?
I wouldn't say bad. It doesn't mean that she's any worse than if only 30% of them were dark. So the fact that she's a French Bulldog, the fact that she's had one disc problem, she is at risk for disc problems in the future, whether it's mild like this one or whether it's as severe or more severe than last time. So really the take home should be that Kyra is at risk for future disc problems. So the things that you can do right now, keep her at a good weight, you know, limit the high impact activity. You know, I don't think there are any
You did sort of know that from that. That's her there. I don't know if you can see.
I can see. Super cute.
She looks like she's an adventure dog.
I know, she loves like going up the mountains. Obviously she's not she's only allowed to go once now that don't have the rocks on them, because she can go up and down the rocks. But no, she used to love doing that kind of thing, you know. And now she's you know, really fat dog. She loves like running around and.
It's a great photo, right in mid-flight. All right. Do you have any other questions?
Sorry, Dr. Wong, I can't hear you.
I was just commenting on the photo that it was a perfect photo where she's mid-flight. She looks. I'm not muted. Can you hear me? Check one, check one.
I can hear you.
Can you hear me? I'm gonna send you a message right now, Christina. Just do you have any other questions? I can hear you.
Is it mine?
So
Oh, sorry, I cannot hear you. No, nothing else. That was all.
Okay. Thank you so much. If you have questions, feel free to email them to Emily. If you have questions.
Great. Thank you.
All righty. Take care. Thank you. All righty. So Emily, you want to just do Amy's question next? Is that?
Yeah.
All righty. So Dr. DiVita, this is from Amy. Hello there. I have a 5-year-old husky that has had seizures since I've had him. He used to have 3 a year, but this year he's already had 5. They are becoming monthly now. We have tried zinc, CBD oil, and changing his biscuits to hypoallergenic. The next step is the vet, but I worry about the side effects of the seizure medications. The seizures have become more distressing as he is now a lot more vocal with them. I do anything to help my boy. Is there anything you can suggest to try or to not give him? Thank you so much for reading. Amy and Apache.
All right. Amy is not joining us on Zoom, correct?
Correct.
Okay, cool. So hi, Amy. It is nice to chat with you, and thanks for sending the question. First and foremost, I'll tell a little personal story that I think I've told you about my connection to huskies with seizures. Have I told you this story? Yeah. So my father had a husky before he had children and before he met my mom. And my father is a corporate real estate lawyer. To give you an idea of his medical knowledge, it's essentially zero, although he tries really hard to understand what I do. So he had this dog. He was living alone with the dog. His name was Sarge, and Sarge was sleeping in the kitchen one night. My dad heard a racket and went out, and Sarge was having a seizure. My dad wasn't able to identify that it was a seizure, and happened to be reading the book Cujo by Stephen King at the time. So he made the assumption that Sarge was rabid and was going to hurt him, and brought him to his vet for euthanasia the next day. Thankfully, his veterinarian talked some sense into my dad, and he actually did great, went on seizure medications, and eventually, he lived to 15. So he lived a very long, healthy life, and his first seizure was at about 6 months of age. So just a little personal anecdote that I like to tell people, that I realize how distressing it can be. I think when myself and Dr. Wong see seizures, we see this every day, and sometimes we can forget how distressing it is for some owners. But telling that story brings me back to, well, if this was my dad, what would I be telling him? So the first thing I would tell you is that certainly, when he was only having 3 a year, I think it's reasonable to not rush into putting him on medications. But now that they've gotten more frequent and more severe, I think we have to consider a different course of action. To comment first on, the things you've tried already, the diet change and the zinc and the CBD oil. There aren't lots of good peer-reviewed research studies to show that those will help with seizure control. There is a veterinary prescription diet called Purina NeuroCare that contains a lot of vitamins and omega-3s and antioxidants that can really help to support brain health and brain function. But again, it wouldn't be my primary, my primary treatment or therapy for Apache. It's definitely something that you could use in conjunction. So the second point that I'll make is if Apache were my patient and he were having seizures once a month, I would definitely recommend that he's put on a seizure medication so that we can decrease the frequency of those seizures and hopefully decrease the severity, meaning the duration and the time for him to recover and go back to normal following the seizure. There are lots of options for seizure medications, some of which have more side effects and some of which, are a little bit, quote, safer. So lots of people have heard of phenobarbital. That's one of our more kind of tried and true seizure medications. But a lot of people will read about, the potential for liver problems and the potential for wanting to eat more and then therefore gain weight, or drink more and therefore have to go to the bathroom more. Those are all very real concerns. But with careful monitoring of dogs on that medication, we can essentially avoid running into an issue as long as we monitor them closely, doing things like blood work and checking the level of the medication in the blood every 6 months or so, or when we start the medication. We can kind of keep on top of an issue before it arises and make adjustments if we have to. The good thing is that we've also kind of found some safer seizure medications that don't come with quite as many side effects. So one of the ones that I like to start with is called Keppra. Keppra is a relatively newer seizure medication, but doesn't come with a lot of those side effects. It's not processed by the liver or the kidneys. It's actually processed by enzymes in the blood. So we don't worry too much about damage to the organs with that medication. Dogs can get a bit sedate on that medication, but generally that's transient. And most of our younger, otherwise healthy dogs, you wouldn't even know they're on a medication when we start with that one. Keppra also has a really big dose range, so we can start at a kind of more modest dose and dose escalate or increase the dose if we need to. So it gives us a lot of room to, kind of play with the dosing and get it right, or take some time to get it right. So I do realize that, having your dog on medications for life, which most seizure medications are for life, can be a daunting thought. But I do think that it's a risk-benefit kind of ratio that we have to think about is the benefit of giving the medications and the risk of giving the medications, does that outweigh the risk of having multiple seizures or getting into a situation where we're having 4, 5, 6, 7, 10 or 20 seizures in a day? And those obviously become a little bit harder to control even in a hospital setting. So I absolutely think for Apache that the reward of gaining better seizure control far outweighs the risk of a lot of the medication choices that we have. Obviously under the direction of a veterinarian who's comfortable to prescribe those medications and to monitor and things like that. The other thing I'll touch on is that we never expect to completely eliminate seizures, so I don't want to set you up with that expectation. We do want to, again, decrease the frequency and decrease the severity. And I like to tell people, decreasing them by about 50%, or, for Apache, having a seizure every 6 to 8 weeks as opposed to every 3 or 4 weeks would be great. If we can get better than that, fantastic. And sometimes it is a trial and error. Sometimes we have to kind of make adjustments or add in different medications, things like that. But that would be where I would start with Apache. So it doesn't necessarily mean that we're going to give him a medication that will cause damage or that will, shorten his lifespan. As long as we're responsible with those medications, I think we can actually provide him a better quality of life by decreasing his seizure frequency and provide you, Amy, a better quality of life for not having to see your dog go through that as often. So Dr. Wong, do you have any other thoughts for Apache?
The only other thing that I would, touch on would be trying to find the underlying cause. Since he's 5 years old, since he's had it for years, since there's kind of a regularity to it, the likelihood is that this is idiopathic epilepsy. The only way that we can truly know it's idiopathic epilepsy is by ruling out all of the other causes of seizures. So blood work to look outside of the brain for low blood sugar, liver problems, kidney problems. Again, much less likely given that it sounds like he's been having seizures, for years. And then an MRI to look inside of the brain for, this isn't going to be a brain tumor. This isn't going to be a meningitis or encephalitis if he's had seizures for years. But there are things like malformations that we can see in young dogs or adult dogs. Certain degenerative causes are still possible that just may change the treatment or the likelihood of success of treatment a little bit. So I think it's certainly worth doing at least a little bit of blood work. Maybe you've already done that, I'm sure you have, but just wanted to touch on, we don't necessarily know the cause, because there are dogs that I read about and that I get questions about that aren't as classic of a history of idiopathic epilepsy as Apache sounds. And it's just important for us to find that underlying cause to maximize the likelihood of us helping.
Cool.
Awesome. We're going to go to Athena next. Again, if you've got questions, please put them in the comments and we'll keep rolling. Hi, Athena. Can you hear me?
Hello.
All right?
Hi.
Hi there. I'm Dr. Wong. This is Dr. DiVita. Where are you calling from? What's your dog's name and what kind of dog is he or she? And How old and what's your question?
Okay, perfect. Hi, my name's Athena. I'm calling from Fresno, California. I have a Shih Tzu. She's 1 year old and 10 months. My question for you is, we believe she had a neurological event. We got all the testing done. Blood work came back good. X-ray came back good. We chose not to do an MRI. Her walking is stumbly, ataxic, but it's getting better. This has gone over for a month. I made her a harness. I was wondering, is there anything I could do to help her with her balance?
Dr. DiVita, do you have any follow-up questions?
Yeah, I guess first I'd like to know a little bit more of a description of what she's doing that made you believe she had a neurological episode or a neurological problem. So,
okay, so she started walking in circles June 3rd. That went away by like June 4th. And then she started, it looks like she had like uncontrollable twitches and tremors and she couldn't walk. And then we took her to the 4 vets. They didn't know what was wrong with her. And they told us that it looked like a neuro issue. They did all the blood work, came back good. X-rays came back good. She would walk for a little bit and then just fall over. She wouldn't let us pick her up. She would be in severe pain. So we did crate rest with her. They gave her amoxicillin because she had bit herself on her stomach. And she's gotten better. Like she can walk maybe like 5 feet now without falling over. But I just want to know, like, what can I do to help her get better, get stronger? Is there anything I could do to?
So when you said she was walking in circles, and so it's kind of compulsive, like she would do circles all to the right or all to the left?
Yes, but that only lasted like a day.
Okay. And have you noticed any sort of like tilting of the head or funny movements of the eyes?
No.
And when she walks drunk, is it kind of just the back end, or does she sort of fall in all 4 legs?
Fall in all 4 legs.
So it certainly sounds like we have a neurological problem. When we hear things like walking in circles, when we hear stumbling, when I hear things like pain, those are all things that are suggestive of a neurological problem. So that's usually kind of our first question that we're trying to answer is this even a neurological problem? The second thing we try and sort out is, well, where is the problem? Is the problem in the back, or is it in the neck, or is it in the brain, or is it in the balance system? And when I hear things like walking in circles, and I don't think you said dizzy, but you said something, you know, that made me sound more like falling and being off balance. I think maybe you said balance. When I hear things like twitching, that makes me worry more about a problem in the front part of the brain. So it sounds like she has a problem in the brain. She might actually have a problem in multiple parts of the brain. So the front part of the brain can cause things like seizures and personality changes and confusion and walking aimlessly in circles. Problems in the back part of the brain can cause incoordination and falling and just being goofy, just incoordination, what we call ataxia. So I would be concerned, be very comfortable in saying it sounds like her problem's in her brain and probably affecting multiple parts of the brain. When I hear that in a almost 2-year-old Shih Tzu, kind of number 1, 2, and 3 on my list of possible causes would be something like inflammation, so meningitis or encephalitis. So meningitis means inflammation of the coverings of the brain, and that can be painful. So you had said that she seemed uncomfortable. Encephalitis, inflammation of the brain itself. So causing those symptoms of circling, behavior changes, incoordination, stumbling, being off balance, etc. So that would be number 1, 2, and 3 on my worry list. There are other things. Dogs can get infections in the brain. They can have strokes. She's a little on the young side for that. They can get tumors. She's a little on the young side for that. They can get malformations or degenerations. She's a little on the older side for that. Usually that should start a little younger in her category. So that's why I would be most concerned about inflammation of the brain.
Okay.
So a conversation from here is going to be a lot based on the assumption that it's inflammation of the brain. Inflammation of the brain or encephalitis in dogs is typically autoimmune. So her body's defenses, her body's immune system that normally protects her, mounts an attack against herself. So it loses the ability to say what's me and what's not me, and starts attacking her own meninges or her own brain. And that is what causes those symptoms. It's something that classically comes on in young adult, small breed dogs, females just a little bit more than males, and its onset can be kind of out of the blue, normal one day, very dramatic the next day, or it can be kind of one of these things that good days, bad days, but in general kind of gets worse over time without treatment. Diagnosis is via examination. So seeing her in person is typically via MRI and spinal tap. And the prognosis is what we call guarded. So some dogs that we diagnose and treat can do fantastic. I've got dogs that live 7, 8, 9, 10 years. You know, they die of old age at 16. Kind of the next population of dogs that we diagnose get better with medications, but then they have relapses, and we adjust the medications and they get better, and then they get worse. It's a little bit of a roller coaster. And then many dogs, you know, 20, 25% of dogs with this condition, even with aggressive treatment, can get worse and actually die of it. So this, if that's what she has, and it's an if,
Yeah.
Is a very serious condition. If there's one thing that I could, you know, impress upon you is if you're able to go see a neurologist, even if you can't do an MRI, get that evaluation, just because this is something that can get worse quickly, and the sooner we treat it, the better chances we have of trying to help. So if there's one thing, try and meet with a neurologist. They're almost certainly, you know, assuming what they see is similar to what I'm envisioning, they're almost certainly going to recommend an MRI, which is absolutely what I would recommend to you. It was absolutely what I would do if she were my dog. So be prepared for that recommendation. If you're able to follow that recommendation, fantastic. The more information we can get, the more specific and aggressive treatment that they can do for her. If it's something that an MRI just isn't possible, because MRIs, there's a cost associated with them, there's anesthesia associated with them, there's, you know, somewhat limited availability, but in California, you know, there are plenty of neurologists and MRI centers there. That's the one thing that I would say, and kind of the sooner you can get there, the better. I realize with coronavirus, you know, the first person we talked to is in Northern California, and she said, you know, they're only taking emergencies, and you know, the wait is until September. I just worry when I hear things like what you've described for your puppy.
Yeah, we see it better every day, but we know there's something wrong there. Yeah, but okay.
Yeah.
Okay, well,
that's good. You know, I don't mean to scare you. You know, but
yeah,
it sounds serious. It's nice that she's improving. It's nice that she's improving, but I would keep a close eye on things.
An MRI of the head or MRI of the spine?
Based on what I'm hearing, it sounds like an MRI of the head, but that's something, if you go and you meet with a neurologist that's able to see her in person, and they say, Dr. Wong has no idea what he's talking about, we need to MRI this part, believe what they say, because they have the luxury of seeing her in person.
Yes. Okay. Yeah. All right. Is there anything I could do in the meantime? Like if they do say you have to wait till August?
I think a lot of it depends on how she's doing. If the trend is up, I'd say just keep doing what you're doing. But if you see that she gets worse and you can't get in there, your local veterinarian, if you're able to get into within an emergency hospital, or sometimes even internal medicine doctors, many of them have some training in neurology. There are medications that are that can be tried. I'm not allowed to prescribe for you, but one of the medications that is a cornerstone of treatment for dogs with encephalitis is prednisone. So not that I'm prescribing it, recommending it.
Yeah.
If that comes up in conversation, that is a medication that we use frequently for the treatment of encephalitis. Prednisone can treat a lot of other neurological conditions. So if she responds, it doesn't necessarily mean that that's what it is. Prednisone can actually make some neurological conditions, like a fungal infection, can make it much worse. So that's why it's very important to have someone that can evaluate her in person, make sure that that's the right medication, as opposed to me across the US trying to make that.
Okay, perfect. Okay, well, I appreciate you answering my questions. Thank you.
Do you have any other questions?
No, I think I'm good.
Well, great. Well, if you think of anything, feel free to reach out to Emily. If you've got a video of what your puppy, and I didn't actually catch what her name was.
Bella.
Bella.
Yeah.
If you've got a video of Bella, walking in circles or showing any of these symptoms, feel free to email them to us. That way we can take a look at them and make sure that we're, what we're envisioning is actually what you're seeing.
Okay. Yeah, I want to thank you, because that's how I found you guys on YouTube, because I knew there was something wrong neurologically. So I started looking up NeuroVet, and you guys popped up. So it's been helpful.
That means a lot to me. It's one, amazing to me that we actually just got off the line with someone in Scotland. One, amazing to me, and earlier someone in California. It's amazing to me, how the internet makes the world a lot smaller, and it means the world to me that this is helpful to you, and that
definitely
a little bit of insight and a little bit of direction. Worthwhile.
Definitely. Okay. Well, thank you very much. I appreciate your time.
You got it. Thanks.
Okay. You have a good day.
Take care.
Okay. Bye.
Hey, Linda. Can you hear us all right?
Hi, can you hear me?
I can hear you. Yeah, if you, we've got you sideways, so if you, perfect.
Okay.
Linda, I'm Dr. Wong. This is Dr. DiVita.
Hi.
Where are you calling from? Where's your, what's your dog's name? What kind of dog? And what's your question?
I'm calling from Cheyenne, Wyoming. And we have 4 French Bulldogs and a boxer. And the one that I'm calling about is one of my French Bulldogs. Her name is Sophie. And last night she had a seizure. And it didn't last long. When I touched her, she seemed to come out of it, and then she urinated. And then she got really, really tired and slept through the whole night. And we realized that she may have had a couple other seizures in the past, maybe a month ago, and then one a month or two before that, where she's been laying on the bed and she'll wake up with this moaning, and she got all stiff. And we thought she was having a nightmare. But now that we look back, we think maybe those were seizures. So I have an appointment with her vet for next week, but I don't know, should she be seen sooner? Should this be something that is this an emergency situation? So I'm kind of wondering about those kind of things.
You have any questions, Dr. DiVita?
How old is Sophie?
Sophie is probably about 7. We've gotten these, our Frenchies are rescues, so we don't know exactly how old they are, but I think she's about 7 years old.
How long have you had her?
We've had her for 3 years.
And today, does she seem relatively back to normal?
Yeah, she's fine. I mean, she was fine after. She was a little wobbly, but yeah, she was acting fine. Last week, she was kind of sick. She had diarrhea and she threw up once, but I did the fasting and then the rice, and now she's fine. I don't know if that has anything to do with it, but yeah, lately she's been really sleepy a lot. A little bit better since she's gotten over her diarrhea and stuff, but I don't know if that has anything to do with it, or this is, oh, I can't show you.
Is that Sophie?
That's Sophie.
You heard her name.
Yeah.
Yeah.
So yeah, just kind of worried about her and don't know if we should get her in before next Tuesday.
Dr. Wong, do you have any other questions, or I can start chatting?
So describe again what the seizure looks like. So in the past, she kind of woke up, would moan, but
she would like be asleep, and then she would just start this really deep moan, and we thought, oh, she's having a nightmare or something. And her legs would kind of get really stiff, but I would start petting her and she would be fine.
And when you would pet her, would she like look at you like she was aware, or was she?
She didn't really look at us right away. She would just, her body would, you know, it wouldn't be stiff anymore. And again, we weren't thinking seizure at the time. We were thinking nightmare.
Sure.
So, but last night, she was walking out to the dining room, and my husband said she just fell over. And then it was like she was stretching, like her legs got really, really stiff. She didn't make any sound. Her eyes looked like she was scared. And I went down, you know, to pet her, and she kind of relaxed. And then, you know, like I said, she urinated, kind of like a explosive type of urination. But then she was fine. Like I said, a little wobbly, but then she just wanted to sleep. She probably slept for 10 hours.
Cool. So your description of the episodes is not what we think of as a classic generalized seizure. So when we're thinking of classic seizures, we're thinking of a dog falling over, paddling, chomping the mouth, being unconscious, and urinating and defecating. So some of it definitely fits, some of it really does not. Now we can have seizures that look like what you've described, but for now I think we'll refer to them as episodes.
Oh, okay.
A dog with episodes, they can be neurologic in origin, like seizures or balance episodes or balance problems. They can also be cardiac in origin, meaning coming from the heart. So dogs can have what are called syncopal episodes, where their heart intermittently stops being able to get blood to the body quick enough, and then they have these kind of fainting, collapse, syncopal episodes. So I think the first thing to suss out, you know, would be, does she have evidence of a heart problem, which really tough, obviously, for us to do online, but having your vet do a complete physical exam, and sometimes they'll recommend things like, you know, EKGs to look at the heart rhythm as well. The other thing that might be beneficial for us and for your veterinarian is if she has another event and you're, you know, in the mindset to do so, grabbing a video of the episode, which can also really help us sometimes to suss out, you know, again, is this most likely neurologic or cardiac? But you're chatting with us because, you know, potentially it is neurologic. So we'll talk a little bit about the different causes for seizures. So there are kind of three categories of things that can cause seizures. A seizure is abnormal electrical activity in the front part of the brain. The first category is actually something outside of the brain. So for example, low blood sugar, liver problems, toxin ingestion, which when we have a 3-month intermittent history, toxin ingestion in my book is relatively unlikely unless she keeps getting into the same, kind of garbage and things like that. So that stuff is easy enough to cross off the list with blood tests if we're, if we're truly talking about a seizure. The second category are often the more sinister causes, so things inside of the brain. In a 7-ish year old French bulldog or adult aged French bulldog, they kind of run the gamut of things that could be going on inside of the brain to cause seizures. So they can have, again, sinister things like brain tumors at a younger age. They can have things like autoimmune meningitis. They can have things like infections, strokes. So, when we're talking about a 2-year-old dog, the list is a little smaller. When we're talking about a 15-year-old dog, the list is a little smaller. But when we have a middle-aged adult dog, we have to include all of those things. The last category of things that can cause seizures is idiopathic epilepsy, which is a genetic predisposition to seizures similar to juvenile epilepsy in human children. We typically see that coming on a little bit younger, so between the ages of about 1 year and 6 years of age, but we're not quite sure if she's in that age range. And some dogs don't read the book and present to us at 7 years old. So I have to keep all those possibilities on the list. And again, there's lots of things we can do before we talk about MRIs to figure out, is there something going on? But to answer your initial question was, certainly if you can get into a veterinarian sooner just for, an examination to make sure we don't have any, for example, life-threatening cardiac problems or blood work abnormalities. At this point, as she's had 3 of them, we definitely recommend getting in as soon as possible.
Okay.
And
it's a little tough now with the, with what's going on.
I think in the meantime, in the absence of being able to get into the vet sooner, definitely keep a close eye on her, keep her to a low impact lifestyle. So, don't take her outside on long walks, because if it is a heart problem, that'll stress the heart. So kind of keep couch potato for the next few weeks, keep a close eye, no roughhousing with her brothers and sisters. And again, if you can catch some video of those events, that might be really helpful for your veterinarian to know.
Okay. Yeah, we should be able to do that.
Yeah. I think the last thing, I forgot what I was going to say, what the last thing I was going to say. Dr. Wong, do you have anything else to add?
I think you nailed it on the head. Your main question, I think, was, is this an emergency? And should I do something sooner than Tuesday? Looking at her sleeping comfortably on the bed there, being kind of annoyed by having to talk with us, she does not look like she's in an emergent category.
That's what I was thinking, but I don't want to take a chance. So
based on seeing that, I think if you've got an appointment for next Tuesday, you're probably fine. If something changes, if she's walking in circles, if she's having these episodes really frequently, if she goes through a really long episode and doesn't seem to come out after a couple minutes, those would be things that would prompt me to go to an emergency clinic and not wait until Tuesday, or go to your vet now if as opposed to wait until Tuesday. But from what I'm hearing, what I'm seeing,
if things just stay the same, then Tuesday should be okay.
Yep.
Because she's pretty chill right now. Just she's kind of like, don't bother me, I'm sleeping. So okay, well, thank you guys so much. I appreciate it.
Nice meeting you, Linda.
Okay, have a good day.
Okay, bye-bye.
You too.
Bye.
I think we should call it. It's 2:56. Again, thanks everyone for your questions and for watching. If there's anything we can do, send us a question. In the future, if you have a question, you can email it to us at Q&A, so the word "and" spelled out, so QANDA at SEVneurology.com. And hope this was useful to everyone. Thank you, Dr. DiVita.
Thank you, Dr. Wong. Have a good day.
Take care. Bye-bye.
Bye.
Anything else? Did I forget to tell everyone?
No.
Okay. Just because everyone kept saying how I do this all the time to her and she hates it. Because everyone's saying they're seeing us on YouTube. It's because of Emily there. All right. Have a great day. Have a good weekend. Be safe. Take care. Thank you.